We're at one of several of the urgent treatment clinics here in Lexington. Dr. Bacha, one of the physicians, has been kind enough to talk to us today. Let's go inside and meet him. Dr. Bacha, what exactly are the urgent treatment clinics?
Well, urgent treatment clinic are several freestanding clinic, several locations that treat variety of illnesses, walk-in, immediate physician services available to the public.
Dr. Bacha, where are these urgent treatment clinics and what are their hours of operation?
Well, there's several. They're scattered around Lexington and the surrounding county. In Lexington, we have mainly 3 locations, one on the north side of town in Park Hill, close to Walmart, New Circle Road. One on Manowar, Custer Drive in Park Hill Shopping Center. One, which is the oldest one, on Dove Run Road off Dace Creek, across the street from Malone. And then we have our occupational clinic off Leestown Road on Trade Street, across the street from the Coca-Cola plant. Now we have one clinic also in Georgetown, close to Kmart. And then our newest location in Nicholasville, hopefully it'll be up and running first week of April, and that's located near Lowe's in Nicholasville. Urgent treatment clinics are open pretty much every day of the week for extended hours. Most locations close at 7:30, and we have one location in Lexington that they open 7 days a week until 7:30 at night time. They open at 8 o'clock in the mornings. The Georgetown location also opens 7 days a week, and the Nicholasville location also opens 7 days a week as well.
And how is an urgent treatment clinic different from an emergency room?
Well, we don't have a hospital attached to us, so we cannot treat life-threatening illness, so we cannot treat a heart attack or stroke. But we can treat majority of the illnesses that comes up on daily basis, fracture, tear, laceration, minor trauma, car accident, work-related injuries, do a variety of physical, sport physical, school physical, preventative health, evaluation of most common problem, cold, flu, urinary tract infection, somebody with bellyache. So most of the illness we can treat here. As I say, we cannot take care of life-threatening illness, and ambulance cannot come in and drop patient over here. And definitely we vary from the emergency room, much less wait time. Probably people are providing more friendlier services as well.
Who are the urgent treatment clinics staffed by?
Well, we have a physician on staff. Also, there's a physician assistant or a nurse practitioner that sometimes help the physician. We also have several nurses, x-ray techs, phlebotomists.
Dr. Bacha, could you tell us more about the occupational services you provide?
Well, we have a dedicated occupational health clinic, the one on Leestown Road. So it doesn't see any urgent care patients. So the only thing it does is just purely occupational health. All the locations do also occupational health in terms of treating injured worker, especially with the convenience of their hours being open late. Injured worker can walk right in and receive the treatment they need. All locations provide drug testing, so that will give the ability for company not to be bound to go to one place, or they have to drive a distance if they're on a particular job site. So they can choose a location that's close to where they're at, and they can receive the service that they need. We also have an integrated rehab services, so we'll try to get the injured worker back to work at a full capacity as soon as possible. We also, as I mentioned earlier, we do provide all the necessary Department of Transportation or pre-employment testing and whatever testing required for such a certification.
Let's say someone drops in with a bad cold. What kind of time would they expect to wait and then to get treated?
Preston, is difficult to estimate waiting time because so many people do not make appointments. But we're trying to get people in and out within an hour, hour and a half. Most of the wait usually actually is not waiting for the physician or the nurses. Most of the wait usually is filling out paperwork and making a copy of insurance card and so on. Of course, if you come in for something straightforward, does not require X-ray or laboratory testing, your visit will be significantly shorter. Most of the delay usually happen if we end up having to take X-rays or do any kind of testing for more complicated case. That's the one that usually kind of consume more time, and you can expect probably a total visit time of about an hour and a half to 2 hours.
What forms of payment or types of insurance do you accept?
We accept pretty much most insurance. Of course, self-pay are always welcome, and we do file with workman comp or car insurance for car accidents or work-related injuries.
In the case of someone not having insurance, what can they expect?
Well, usually payment is expected at the time of the service, and usually they're provided with a discount from the normal fee, assuming that they pay their bill in full at the time of the service. And that discount mainly because we don't have to file paperwork with the insurance and wait on payment and so on.
In addition to the basic physician services, what sort of tests do you provide?
Well, we do have full X-ray on site, and we do have lab. We also have an off-site lab as well, and then we have an access to a network of specialists and advanced radiology services available to us readily.
If you would, tell us more about the primary care services you provide.
As I told you, if a patient does not have a primary care doctor and wish for the urgent treatment clinic to take care of their primary care need or family need, we'll treat a variety of illnesses, hypertension, diabetes, heart disease, high cholesterol, provide adequate screening, and so on. Also, we do provide sport physical, school physical, provide tetanus immunization, hepatitis B booster, and so on.
Dr. Bacha, we really appreciate you taking the time. We'll see you around, but hopefully not too soon.
All right, thanks, Preston.
Thank you very much for speaking with us today.
You're always welcome.
Appreciate that.